Good morning, everyone, and welcome to Health Talk, Long Island Health Talk from Nassau University Medical Center, the hospital on Hempstead Turnpike, the Level 1 Trauma Center that hopefully you don't have the occasion to use. But we're here for you when you need us. We are a full-service hospital providing some of the finest care in Nassau County. Some of the top doctors and some of the top facilities you'll find anywhere are right here in Nassau County. This is our talk on Saturday mornings, in which we bring in some interesting guests and we talk about health issues and other issues that are of interest to our listeners here in Nassau County, Suffolk, and elsewhere. And also, it's also on media that you could download and view these discussions if there's anything interesting that you want to hear again. So today, we really have a great guest, someone who really will bring a lot of information here and some interesting stories. And she's a legislator with the County of Nassau. And legislators, if you don't know, in the County of Nassau are really a group of men and women that really discuss and put forth a lot of rules and regulations and projects and lots of discussion. It's the place where communities can express their feelings at various projects that are going on in the county. And today we have Legislator Rose Walker with us, and she'll give us an insight into what's going on with the county and the legislature and exactly what that means to be a county legislator. So it really is a real honor and a pleasure to have Ms. Walker here with us today. And I'd like to welcome you today, Ms. Walker, to the show.
Thank you.
Welcome. And why don't you tell us a little bit about yourself, and then we'll talk about what you do.
Sure. I'm a lifelong resident of Hicksville. My mom and dad moved out to Levitt home, bought a Levitt home when Levitt first built those homes after the war, and that's where I've grown up, and that's where I've raised my children, and now helping to raise my grandchildren here also. So it's just a little bit about my background. I was an education major. Never actually thought I'd be in the field of being a public official, but my name was chosen. I went and interviewed, and this is, I guess I'll be finishing up my 12th year soon as an elected official. I spent 6 years as a councilwoman in the town of Oyster Bay, and this is finishing. Once this year is finished, I'll be finished 6 years in the legislature. So.
It's really great. Nassau County is really what a great place to live. It's got so many great things for the children, parks and the beaches, and just the schools are excellent. We're sort of blessed to live here.
We truly are blessed. My children, certainly myself growing up here, and all the different activities that you had, and between your school activities, your community activities, county, the towns, just so many things for our children to be able to do and take part of. And I think today it's even more important because we live in a different world today. And, people are always looking for more structured activities, not like when we grew up and you could just go to the ball field or go out to play with your friends and, you'd come back when it was time for lunch or time for dinner and, or before the street lights went on. But it's not how it is today, and people like to have many different choices for their children to be involved in, and many places for them to go as families, and we certainly have that here. The county offers tremendous programs, from our summer recreation programs to all the different senior citizens events, the concerts, all year long activities, and certainly on Museum Row that we could take our children to. A lot of discounts over this winter break, so people should look into that if they're interested in being someplace local with their families. Today it's harder for people to go away, and finances are tough, and they're looking for things at home, and we have a lot to offer here.
And that's true. I grew up in New York City, and you went out, you rode your bicycle, you came home. But in Nassau County, and I raised 2 children out here, they really were busy, right? They got out of school, they were into organized sports activities.
Absolutely.
My daughter with dancing and all the other things that these these kids do
Right.
together, and it really is great. And you mentioned Museum Row. That's a fire museum. That's a really great place to go.
Absolutely, absolutely. The Cradle of Aviation, the Fire Museum, the Children's Museum.
Hmm.
I mean, you could go to a different place every day, and the kids want to go back. You
Right,
know, I
right,
know my
right.
little grandchildren. I could take them to the Fire Museum every single day, and they
Yeah.
would be thrilled.
Yeah. I know they
So,
have the National Coliseum there now, and they're going to
absolutely, with
rebuild
the
that. And
yep, absolutely, and hopefully have even more shows that are brought in that are
yep.
our families are able to go to locally.
Yep, yep. They'll have circuses and things for the kids, as well as all sorts of top entertainment at night for
Absolutely.
bands and concerts, and all those great things that really make Nassau County a community. And people really feel that this is their home, and that they really take pride in Nassau. And part of that is the legislature. And you being a legislator for 12 years have been involved in so many different initiatives here in the county. So why don't we tell the listeners what is the Nassau County legislation, and what do they do?
Well, there are 19 legislative districts,
Mhm.
and each of us represent a certain area. And mine is the 17th legislative district, which encompasses part of Hicksville, part of Bethpage, uh, part of Farmingdale, Plain Edge, North Massapequa. I have a little piece of Wanto, a little piece of Seaford, and a little bit of Plainview, all Bethpage. So I really do encompass a large area, and I work very well with the legislators that surround my area too, because it's it isn't just your immediate area. You involve the entire county. I serve on various committees in the legislature. I'm the chair of the Health Committee and vice chair of Veterans and Seniors. I also serve on the Finance Committee, the Minority Affairs Committee, and I believe there's one more that escapes me at the moment.
Public
but,
safety?
No, I'm not on public safety, although oftentimes we're subbed into different committees if someone can't be there.
Right.
And I have subbed on the Public Safety Committee very, very often, which is very, very interesting.
And so all the legislators work together, I would assume, no matter if you're a Democrat, Republican, for the best interests of the county.
Yes, that's you certainly do try to, and sometimes we're better at that than others, and but it is very important because although we represent our district, we are working for the betterment of the county as a whole.
And I've seen that when I've gone to some of the legislation, some of the hearings and some of the meetings, and I've seen really heated debates between legislators on different projects and different things, and people speaking in front of them to get their point across. And it just seems that eventually everyone comes to some sort of agreement, and it works out. It's
Right,
amazing.
right. Some issues are harder and tougher
Okay.
to deal with, and the arguments can be a little bit more heated. But I do truly believe that we certainly all care about our districts and about the county, and working together is a big part of it.
Right, right. And I know I speak sometimes to the legislative leader, Norma Gonzalez. We also trying to have her on our show, and also to speak to her about some things that are going on in the county. And it's not an easy job. You put in a lot of hours. I know you're everywhere. I remember when I was going to all the different fire department dinners on weekend, you'd be at every one. I mean, you really put on a lot of miles on your car.
I really do try to. I feel that that's a big part of our job is reaching out to the community, being a part of the community, and when you're invited to go somewhere, it isn't for me, it's for them, and I just think that's very important. The Eagle Scouts that we go to, the senior events, the veterans events, fire department events, and you work together, and it gives you an opportunity to hear what their concerns are, what their problems are, what their issues are, and to be able to help and work together and make things better certainly for your own community, your own district, but certainly for the county as a whole.
Yeah, and I know my discussions with even the police officers and the firefighters and the EMS workers that you are an ear, and they know they could talk to you at any time about any
Absolutely.
issues, and you would really represent them well. And I know they're always very grateful when you show up at those different events. It does take a lot of your time. How do you stay focused on your private life when you spend 24 hours a day, 7 days a week doing this?
It is, you have to have that balance. Certainly, I'm a mom of four.
Mhm.
I'm a single parent. I
Mhm.
lost my husband in August. Will be 16 years that he's gone. He was very, very young,
Mhm.
and but my husband loved life, and he would never have wanted to see us fall apart. And
Yep.
so, we pulled ourselves up by the bootstrings, and we have to go on for him and
Yes.
to continue his legacy. And he was always very involved, very community minded, very active,
Mhm.
and so that's just how
Mhm.
we've
Mhm.
continued to live our life. And but you do have to have that family time, and I'm
Absolutely.
blessed now with three. In August, well, the end of July, she'll probably have the baby,
Oh, very
but
good.
she's due August 5th, but she'll be a scheduled C-section. So,
Congratulations.
and she won't be able to be delivering in the new maternity ward in the medical center. But should any emergency
Yes,
come up, I'll
yes.
know that she can
Come
run
right
there.
over.
And but you know, helping to raise four beautiful grandchildren will just makes my life
That's beautiful.
all the better.
And actually, you mentioned that you were at the ribbon cutting
Yes,
at
I
the
was.
hospital when
Yes,
we
I
opened
was.
up our new labor and delivery suite. And
Which is absolutely beautiful. I could only there's so many things you've done in the hospital that are just totally amazing. I mean, I go back to when it was Meadowbrook Hospital,
Right.
and it was just a small little local hospital,
Mhm.
and now to see where you've come, and oftentimes I think people um, kind of don't look as highly on the medical center as they should,
Mhm.
but certainly being more involved now than I ever was before, being a legislator. What you've done in the hospital is absolutely amazing, and I certainly give a shout out to you, and certainly to Shelley, and to Anne Marie, and to all of you, to all your staff, to all
Sure,
our workers there.
sure.
They do an amazing job.
Well, a lot of what we did couldn't have been accomplished without County Executive Mangano's input and his support. A lot of the finances that we need, he came right to the hospital and helped. He was at the ribbon cuttings, and he's very visible at that facility, giving us a lot of support. And I know that yourself, you're there, and you come to all our events and speak to the employees and the patients, and everyone really appreciates that.
You really do some amazing things. I mean, I've had to be over in the emergency room with my mom. She fell, and so of course we brought her right there because you did see what she looked like when she got there, and
Mhm.
and knowing that it's a #1 trauma center, I wanted to make sure she was there, and she was treated so spectacularly,
Thank you.
and like I said, the doctors, the nurses, all the staff in the hospital, and not just medically. I think it's very important. Sometimes we forget the human side of medicine, and
Right.
sometimes those of you who are, you're taking care of that patient,
Sure.
but I think sometimes, myself, and certainly other people who are waiting to hear about their loved ones, sometimes that extra hand holding or that extra hug is tremendously needed,
Means
and
a lot.
it certainly is there in the hospital, and I can't thank you all
Yeah, sure.
enough for that.
And people don't realize. I did. I'm a Belmore. I never realized the the scope of Nassau University Medical Center.
Right.
And I mean that trauma center is just the opening of the door.
Right.
$38 million level 1 trauma center. Probably the 320 slice CAT scan that we could actually take CAT scan pictures of your beating heart.
Right.
And take a look at the coronary arteries and when you have chest pain. So it's the latest developments.
Certainly
And
your
so
burn
many,
center.
yeah. Oh,
I
burn
mean,
center.
just
Yes.
but just on the everyday needs.
Mhm.
I think many of us, just like I said, we don't tend to look at
Mhm.
at the hospital in the highest regard that we should.
Right,
And
right.
like I said, I've had the
Mhm.
I've been able to really see just what a tremendous hospital it really
Thank you.
is.
And that's one of the goals of this show, is to put that word out so people understand that we have some of the greatest doctors. I mean, we are an orthopedic service. Charles Rotolo and Total Orthopedic Care is probably one of the premier orthopedic groups. So you break your leg, your arm, or any type of spinal problems, we have it right there.
Right.
And you don't realize what go to the hospital. Well, they have a whole floor, and we're actually building a suite, a whole 16 beds that are going to be brand new, dedicated on the ninth floor, all redone, just for orthopedic and spine care. So if someone does have a car accident, or they fall off a ladder, or whatever it is that you break your arm or your leg or any type of orthopedic problem, you'll be seen in the ER, board certified docs, board certified orthopedic
Right.
guys, 24/7 in the house. They come down, they look at you. We do it, surgery in one of our 8 great operating rooms, and then you get sent to a beautiful brand new
Brand new.
floor. And so
told you when I went to the grand opening of the ribbon cutting for the new maternity, labor and delivery, it almost wanted me to have another baby, but it absolutely beautiful.
It is.
Beautiful.
I was even shocked
I
when
mean,
I
it's
walked in there. I
it's
was
like
like,
being
wow.
in a hotel.
Isn't that beautiful, those
It's
rooms?
just unbelievable.
Yeah, the rooms are, it looks like a real fancy hotel room with a bed and the paneling and a really nice
Right.
bathroom with a shower
Right,
and
right.
and then all of a sudden the walls spin around and it reveals all sorts of medical devices and monitors, and then the lights come down out of the ceiling below
Absolutely.
and it turns it into an operating room if need be.
Right.
And women can come in and they give their they go through labor right there. They deliver their child right there, and everything right in that room, which is pretty spacious
It
rooms
amazed
too.
me. Absolutely beautiful.
Yeah, and we're doing that. We're doing that now. Next week or 2 weeks, we're going to have you're invited as well. We'll let you know the date of a ribbon cutting because we have a brand new intensive care unit, brand new coronary care unit, and a brand new surgical intensive care unit. So just like we did in the labor and delivery,
Right.
with beautiful flooring and beautiful wall colors and nice paneling and brand new equipment, we're going to be opening up all these intensive care units.
That's
I think it's the
great.
26th, February 26th. We'll have the ribbon cutting, and you'll be amazed at what that looks like. So, if God
And your
forbid,
emergency room,
Oh.
the emergency room area is,
exact 2 years old, $38 million just for that ER. So, and not only that, but now if you come to the hospital in the emergency room, and God forbid you have to go to an intensive care unit, you'll move right into one of these
And then- right.
brand new suites. So, and we have an elevator in the emergency room that takes you right up
Right
to
upstairs.
it, right upstairs to the intensive care unit. So,
And I really like the idea that you, in the emergency room, where you have more of a pediatric area, which I think is very important too,
Yes.
because for little children, you
Yep.
don't need them necessarily to be seeing all the other trauma
No.
that's going on, and trauma and drama
And
that's
trauma and
going
drama,
on
yes.
in other parts of the emergency room. So they kind of have their own little space, and
yeah. We put nice glass doors separate the pediatric emergency department
Right.
from the main adult emergency department, and it's good to know that not only do we have board certified emergency room doctors, but we have board certified pediatricians. And you'll say, oh, why can't I go to my pediatric doctor, or why don't I go to an urgent care center? Well, I mean, and they're great and they really serve their purposes. But when you need a pediatrician
Right.
24/7, you come to the hospital.
I know my daughter was tubing,
Mhm.
and it was not long after we lost my husband, and she hit a little mogul and
Mhm.
flew in the air and landed on her head, and
Mhm.
so of course we rushed her to the medical center, and her care was unbelievable, and I thank God she's fine.
That's
She's
good.
fine, but when you're needed, you
Yep.
want to know that there's a place close by that you can get there, and you're being taken care of in the best possible way.
Well, thank you very much, Legislator. And we're trying. We're trying to, even as we speak, improve. If you drive by the hospital now on Hempstead Turnpike, if you look on the first floor to the right, you'll see all new construction. And what's going on there is basically a $24 million primary care center. So we're going to have private offices in there for all sorts of medicine, obstetric, and pediatric practices. So brand new building, brand new floor.
Floor.
We're redoing the whole thing, and you'll have all specialists, pediatric allergy, pediatric neuroendocrinology, they'll have all specialists there for pediatrics, obstetrics, all sorts of gynecological experts, and then we'll have all our internal medicine people with their cardiology and pulmonary and nephrology. So people could just call the hospital, one phone number. It's 486 6862, otherwise known as 486 NUMC. So 486 6862, one phone number. You call, you say, I'd like to see a physician. I'd like to make an appointment for an endocrinologist. I need, my leg hurts. Can I see an orthopedic doctor? And that call will then set you right up with a date and a time to come in. And, we should have the brand new primary care center open in June, but we still have our other areas that are there to see the patient, so that number's still active. And when you drive by, whoever's driving by, look at the hospital. You look on the ground floor, you can see all the work that's being done. And we're really trying to make this place, the premier hospital. And the county and the legislature have always really supported, because we are the safety net hospital. We are the
Absolutely.
public hospital, and we want to be able to provide care at the highest level to the people that need it. And that's our mission. That's our mission at that hospital.
I am very lucky, although the hospital is not in my district. I'm probably one of the legislators that live the closest to the hospital, living, right near Carmen Avenue. And so, like I said, I feel like we have a gem. We have a gem there in the county, and we have to get that word out.
Yeah.
I thank you too. All the legislators take advantage of the mammography van,
Yes.
and we bring it into our districts, and we have people come and are able to get their mammographies, locally. They don't have to get to a doctor's office. They don't have to go to the hospital. They can come right to someplace that's close within their home and be able to get a mammography, which is so
That's
important
great.
because we all know that prevention is the best medicine.
Absolutely.
So-
Mammography, you can't never overstate the need for preventive care, for
Absolutely.
screening.
Absolutely.
How do people know when that van goes to your area?
We advertise it. I send out, like if it's my district, I'll send out a postcard letting people know that the mammography van will be at such and such a site. Usually, I used to always do Caniac Park, or I do Bethpage Community Park, just because, it's an easy
Sure.
site for them to get to. They know where it is, and parking is easy. And all the other legislators choose places within their district, and then we send out a postcard letting our district, know. And people call the office. My number is there for them to call for an appointment, and we tell them, anything they might need to know. And we set up that appointment, and
That's
just
great.
runs on schedule.
Now,
and
that mammography van has the latest in imaging. It's called tomosynthesis. Most hospitals don't even have that level of sophistication. In the hospital, in National University Medical Center, we do have a second women's health area
Right.
that has a tomosynthesis mammography. But this van actually has that level, which could pick up even the smallest and minute
which is excellent.
cancers, because the sooner we catch it, the sooner
Absolutely.
we find it, the sooner we remove it, the better the health outcomes.
Absolutely. And, you've taken that van. I had jury duty, and the van was at jury duty.
Yep.
And they announced, if anyone,
Right.
should be going for mammography, and they do the same with prostate screening.
Yes.
And,
Yep.
so many different. Education, I think, is still so important, and getting that word out, and, like I said, prevention, making sure that you go for the exams we should go. Many of us tend to put that in the back of our minds, and
Yes.
we don't do it, and we should, because if we do, there could be very different outcomes.
We have found countless lesions, and we've saved many lives. And in the hospital, in addition to the oncology section, is our plastic surgical group with LIPS, LIPS, Long Island Plastic Surgical Group. And people don't even realize that this is one of the premier plastic surgical groups in
Right.
Long Island. They're in our hospital. They have a floor in our hospital. Their doctors are there. So if someone gets injured, they get a laceration, a child gets a laceration on their face or cut, something that they need. We have those LIPS, Long Island Plastic Surgeons, right in that hospital. And they do breast reconstruction as well. And they have done some amazing work. And I know patients come back all the time to the hospital to meet with those doctors to thank them. And it's really a great thing to see when you're actually able to do something like that. And preventive medicine is so important today to prevent people from becoming sick and getting them before they get their
Absolutely.
blood pressure out of control and all that. And your help and getting the word out to your constituents to get these vans and to put them out there in these areas and bring.
Absolutely.
You probably detected and saved so many lives yourself.
Well,
Madam
we certainly
Legislator.
hope that we can help make a difference, and certainly you are, and the hospital is, and with all the programs you have. And I work very closely too with the health department, with Larry Eisenstein and
Great
his
Dr.
department,
Larry.
and
Yep.
he's absolutely amazing.
Yes, he's great.
And all the wonderful things that they have done, and awards that they have won. I can't certainly have to give a shout out to them too,
Yep,
because they've just been great.
Yeah, Larry's great. And, we didn't mention his name, but someone who's behind the scenes all the time and really is someone who lights a lot of fires and gets things done is Rose Walker. And Rob is,
Thank you.
he really is a dynamo. I've never met a man in my life that does as much as he does and does it well. And I know myself personally, he's helped me, move forward. And I've actually watched and learned from him the way he operates with different departments and how he handles the budgets and how his financial plans work in the county, and I'm at awe when I see him actually working. So that's kudos to
thank you.
to you.
He certainly, all my children make me very, very proud. But I have to say he's truly is an amazing son. I don't know where I would have been without him when John passed away.
Sure,
I mean, he was 24 years old, and he took on responsibilities that, a young man shouldn't really have to take on,
Right.
but he did, and my other children certainly
Sure.
look up to him, and but he's smart and he does his homework and he works very, very hard, and sometimes I have to remind him that we're all not on the same page as him. He gets things very quickly, and he grasps it and he holds on to it,
Okay.
and he rattles off information that I feel like I need a tutorial on
That's right,
sometimes.
right.
But
It's true.
he does work very, very hard.
Whenever I had to meet with him, I had to make sure I did my homework.
Yes,
Because
exactly, because he did his.
Because he knew more about it than I did when I walked in the door to ask him a question. So you always had to be ready for that, and it's great. And between him and Mr. Mangano, we are really blessed in Nassau County. This is,
I truly believe that. I mean,
Right.
I came onto the legislature when our county executive,
Mm-hmm.
first came on as county executive, and I think we have worked very, very hard together, and they truly are people-oriented
Mhm.
elected officials,
Mhm.
and they truly care about people tremendously and
Mhm.
care about the communities that people live in, and I think that we've really all tried to work together to do what's best for Nassau County, and there's always room for improvement,
Yep.
and we have to keep going. It's very difficult times,
Mhm.
like I said, financially for all of us, no matter where you are, and we just have to keep plugging away to do what's best and help our residents as much as we possibly can.
Yeah, and I believe knowing them and seeing how hard they work, like yourself, 24/7, they're out there and they really in their heart want to do the right thing. They're lifelong
Absolutely.
Long Islanders that raise their children
Yep.
and families here.
Absolutely.
I could see the pride in them that they really want to do everything they possibly do the right thing for Nassau County.
I know they don't ever sleep. That's
true.
for sure.
That's true.
I know I don't sleep very
Yeah,
much,
yeah.
but I only really have, in particular, my district to worry about, even though it does, follow
Yeah.
it into the rest of the county, because, like I said from the beginning, it isn't just your district.
Yeah.
We really are involved in the entire county, and we have to work together to make sure that we work for the entire county.
And it's a big county, over
Absolutely
3
is.
million people. It's got I'm sorry, 1.3 million people. I'm sorry, that are here in Nassau County, and it's very diverse. It's got 3 towns, a couple of cities, 71 fire districts. I mean, it's really a complicated school districts. There's so many different moving parts here that you as a legislator or as a county executive have to get a grasp on. And
Absolutely.
it's really hard because what affects one town one way or one city one way affects another town another way.
different
So
way.
yeah, so you have to be really very balanced in what you do.
Exactly.
And find out all the facts before you guys do stuff. And it's a difficult job, and yet people like yourselves do it, and then they do it again. and they
And, the biggest part, I think, is and what I like best, I think, about being a legislator is you can make a difference in people's everyday lives. And I know this is not on the federal level and it's not on the state level, but local government really is so important, and I think people forget about that sometimes. And we work hard together to make a difference, to hopefully make things better. And you can't please everyone. You know, sometimes people are complaining about something and they don't understand why. Well, you can't fix that. And sometimes it's just not possible to fix everything and to make everything be what everyone wants it to be. But you have to work hard to try to do the best for the majority of people.
Well, you've done so much over those 12 years, and just driving around in the communities that you mentioned, I see your mark has been made, and you have so much energy and enthusiasm, and you bring so much to the table that, Legislator Walker, we hope you stick around for a long time and
Thank
stay
you.
right where you are and just
Thank
keep
you.
fighting the fight, because I know in your heart and in your mind, you're doing everything for this county that you could possibly do.
Thank
And
you.
I as a citizen, thank you for all the hard work, and the things that you do every day. And it's such an underappreciated job, but believe us, the residents here know how hard you work, and we thank you for this. So,
Well, thank you.
right.
Thank you.
So I just want to thank you for being here today.
It's my pleasure.
And you're always welcome to come back if you have some new initiatives or anything that you want to get the word out with me, and we'll talk about some healthcare changes, because there are a
Great.
lot of stuff coming down the road with the dish rip and the different changes in Medicaid and Medicare, and that'll be affecting the elderly and the younger persons that live here. So we could discuss that sometime as well.
Excellent.
So I just want to say to the listeners to thank you very much for listening today. We appreciate everyone being here. I hope it was interesting. I loved it. I just love talking to Miss Walker. She's always full of so many good things. And so I want everyone to have a great day today, and stay healthy. And if you need us, we'll be there for you. It's Dr. Victor Politi. I'm the president and CEO of the hospital, and I'd like to say goodbye. Goodbye.